Hello. Welcome to my channel Health Pointers.
Topic: Diabetes mellitus. Introduction. Diabetes mellitus, commonly known as diabetes, is a chronic metabolic disorder that affects millions of people worldwide. It is characterized by high levels of sugar, glucose, in the blood, which can damage the body's tissues and organs if left untreated. In this video, we will explore the pathophysiology, risk factors, symptoms, epidemiology, prevention, and treatment of diabetes mellitus. Types of diabetes mellitus. There are several types of diabetes, but the most common ones are Type 1 diabetes, Type 2 diabetes, and gestational diabetes. Type 1 diabetes. Type 1 diabetes occurs when the immune system attacks and destroys the cells in the pancreas that produce insulin, a hormone that helps regulate blood sugar levels. Type 1 diabetes is usually diagnosed in children and young adults, and its causes are not entirely understood. But it is thought to be due to a combination of genetic and environmental factors. Type 2 diabetes. Type 2 diabetes occurs when the body becomes resistant to insulin, and the pancreas is unable to produce enough insulin to maintain normal blood sugar levels. Risk factors for type 2 diabetes include obesity, physical inactivity, unhealthy diet, age, and family history of diabetes. Type 2 diabetes is more common in adults, but it is becoming increasingly common in children and adolescents due to rising rates of obesity. Gestational diabetes. Gestational diabetes occurs during pregnancy and usually resolves after the baby is born. However, women who have had gestational diabetes are at higher risk of developing Type 2 diabetes later in life. Pathophysiology. In diabetes mellitus, the body either does not produce enough insulin or is unable to use it properly. Insulin is a hormone that regulates blood sugar levels by helping glucose enter the body's cells. When insulin is deficient or ineffective, glucose remains in the blood, leading to hypoglycemia, high blood sugar. Over time, this can damage blood vessels and organs, such as the kidneys, eyes, nerves, and causing complications, such as diabetic retinopathy, neuropathy, and nephropathy. Causes. Type 1 diabetes occurs when the immune system attacks and destroys the cells in the pancreas that produce insulin, a hormone that helps regulate blood sugar levels. Type 1 diabetes is usually diagnosed in children and young adults, and its causes are not entirely understood. But it is thought to be due to a combination of genetic and environmental factors. Type 2 diabetes occurs when the body becomes resistant to insulin, and the pancreas is unable to produce enough insulin to maintain normal blood sugar levels. Risk factors. Several factors can increase the risk of developing diabetes mellitus. These include 2. Family history of diabetes. 3. Obesity or overweight. 4. Sedentary lifestyle. 5. High blood pressure. 6. Abnormal cholesterol levels. 7. Gestational diabetes during pregnancy. 8. Polycystic ovary syndrome, PCOS. 9. Age, 45 or older. Symptoms. The symptoms of diabetes mellitus can vary depending on the type of diabetes and the severity of the condition. Some common symptoms include 3. Increased thirst and urination. 4. Weight loss, type 1 diabetes. 5. Fatigue and weakness. 6. Blurred vision. 7. Slow healing of wounds. 8. Tingling or numbness in the hands and feet. 9. Recurrent infections, such as yeast infections. Epidemiology. Diabetes mellitus is a prevalent health issue worldwide. According to the World Health Organization, WHO, an estimated 422 million people had diabetes in 2014, and this number has continued to rise. Diabetes can affect people of all ages, but the prevalence is higher among older adults. In addition, certain ethnic groups, such as African Americans, Hispanics, and Native Americans, are more likely to develop diabetes than others. Prevention. While some risk factors for diabetes mellitus cannot be changed, there are several ways to prevent or delay its onset. These include 1. Maintaining a healthy weight. 2. Engaging in regular physical activity. 3. Eating a balanced and nutritious diet. 4. Limiting alcohol consumption. 5. Quitting smoking. 6. Managing stress levels. Treatment. The treatment of diabetes mellitus varies depending on the type and severity of the condition. For type 1 diabetes, insulin therapy is essential to control blood sugar levels. This may involve daily injections or the use of an insulin pump. For type 2 diabetes, lifestyle modifications, such as diet and exercise, may be sufficient to manage the condition initially. However, some people may require oral medications or insulin injections to achieve optimal blood sugar control. Conclusion. Diabetes mellitus is a complex and chronic condition. Understanding its pathophysiology, risk factors, symptoms, epidemiology, prevention, and treatment is crucial in managing the condition effectively. If you suspect you have diabetes or have been diagnosed with the condition, it is important to work closely with your healthcare team to develop a personalized treatment plan. Thanks for watching.